Mis.Medicine एंड थैंक यू आप सब लोगों का जो आप लोगों ने इतना प्यार दिया मेरे प्रीवियस छोटी कॉपी के पार्ट्स को एंड दिस इज पार्ट 9. इफ यू आर न्यू here, subscribe to the channel and follow us on Instagram and Facebook. If you found these videos helpful, do share these videos क्योंकि tumor marker alpha fetoprotein antigen is the product and associated with liver, germ cell tumors and non-seminomas. मैं इसमें सिर्फ ट्यूमर मार्कर और एसोसिएटेड कैंसर के बारे में बताऊंगी. नेक्स्ट वन इज द कार्सिनो एम्ब्रियोनिक एंटीजन फॉर द कोलोरेक्टल कैंसर लंग एंड द ब्रेस्ट. CA125 seen in epithelial ovarian cancer. CA722 and 4 ovarian cancer and the pancreatic cancer. CA199 seen in pancreatic cancer and colorectal cancer. Prostatic specific antigen prostate cancer. This is the important one for the screening. Prostate-specific membrane antigen for the prostate cancer, nuclear scan for metastasis, bladder tumor antigen for the bladder cancer, CA15-3 breast cancer, CA2729 breast cancer, tyrosinase malignant melanoma, thyroglobulin follicular and papillary carcinoma of thyroid, beta-2 microglobulin multiple myeloma and CLL, chromogranin A which is parathyroid secreting protein 1, seen in neuroendocrine carcinoid pheochromocytoma, neuroblastoma, and the small cell lung cancer. Next one is the epidermal growth factor receptor EGFR or HER1, seen in non-small cell lung, head and neck, colon, pancreas, and the breast cancer. Next one is the HER2, also known as HER2 new or EGFR2, seen in breast cancer. HMB45 seen in melanoma, junction nevus, fetal melanocytes. S100 seen in melanoma. TA90 seen in melanoma. NMP22 bladder cancer. Calcitonin medullary carcinoma of the thyroid. Catecholamine pheochromocytoma. LDH lactate dehydrogenase seen in testicular cancer and other germinal cell tumors. Prostatic acid phosphatase PAP seen in prostate cancer. Neuron specific and enolase NSE seen in neuroendocrine. Next is the NSC neuron specific enolase seen in neuroendocrine carcinoid pheochromocytoma, neuroblastoma, small cell lung cancer. Next one is the HCG which is seen in gestational trophoblastic disease, germ cell tumors. BCR ABL seen in CML. Next part is the cluster differentiation markers of the different cells. Type of the cells and the CD markers. Stem cells CD34 TDT. B and T cells precursor lymphoma TDT. Panleukocyte marker common leukocyte antigen CLA presenting in all T cells CD45RB. Naive T cells CD45RA CD45RC. Memory T cells में क्या देखते हैं CD45RO. Pen T cell marker CD3. Pen B cell marker CD19. B lymphocyte CD10. CD90 to 23 and then CD79A. Mature B cell marker CD23, myeloid series anti-MPO, granulocyte CD45 and CD15, monocyte CD45, CD14, T lymphocyte CD45, CD3, T helper cell CD45, CD3 and the CD4, cytotoxic T cells CD45, CD3 and the CD8, megakaryocytes CD61, CD41 and the CD45. Natural killer cells NK, CD16 and CD56, NK T cells CD16, CD56, CD3, plasma cells CD38, Reed-Sternberg cells CD15 and CD30, Langerhans cells S100, LCD1A and CD56, EBV receptor CD21, GIST, CD117 which is most specific and CD34, angiosarcoma factor 8 related antigen UAE1, CD31 which is most specific and sensitive and CD34. Next part is the immunohistochemical markers IHC. Tumor type and the immunoperoxidase staining. Carcinoma in general epithelial stain example CK720 variable EMA, CLA, S100 and vitamin. Colorectal carcinoma CK7 and this CK20 positive. Lung adenocarcinoma TTF1 positive, SURF-A and SURF-B positive. Long non-cell carcinoma CK7, CK20 and TTF1 negative. Lung small cell carcinoma TTF1 positive. Neuroendocrine tumors NS1, NSE positive, chromogranin positive, synaptotropsin. Neuroendocrine tumors NSC positive, chromogranin positive, synaptophysin positive, S100 positive. Mesenchymal tumor, soft tissue sarcomas, vimentin positive, desmin positive. GIST, DOG1 positive is a new marker, more specific and sensitive than CD117. CKD is also known as CD117, CD34, and the smooth muscle actin and S100. Melanoma CD117, HMB45, and S100. Kaposi sarcoma CD117, CD34, and the CD31. Schwannoma S100, mesothelioma mesothelin plus calorretinine. Germ cell tumor GCG-AFP, oct transcription factor, placenta alkaline phosphate, and epithelial stain positive. Prostate cancer PSA positive are false negative and can be positive. Epithelial stains positive. Pancreas carcinoma CA19-9 positive, CK7 positive, mesothelin positive, and tryptophan factor 1 positive. Breast carcinoma ERPR positive, HER2 positive. Next part is the HLA markers. Ankylosing spondylitis, HLA-B27, Reiter's, HLA-B27, acute anterior uveitis, HLA-B27, reactive arthritis, HLA-B27, psoriatic spondylitis, HLA-B27. Next one is a collagen vascular diseases, juvenile arthritis, Pauci articular, DR8 and DR5, rheumatoid arthritis, DR4, Sjogren's syndrome, DR3. Next one is SLE, systemic lupus erythematosus, white DR3 and Japanese DR2. Autoimmune, gut and the skin, gluten sensitivity enteropathy, which is celiac disease, DQ2, chronic active hepatitis, DR3, dermatitis herpetiformis, DR3, psoriasis vulgaris, CW6, pemphigus vulgaris, DR4, and the DQ1, and bullous pemphigoid variant, DQ7. Next is the autoimmune endocrine. Type 1 diabetes mellitus, DQ8, DR4, DR3, DR2. Hyperthyroidism, Graves' disease, B8 and DR3. Hyperthyroidism, Japanese, B35, adrenal insufficiency, DR3, autoimmune neurologic, myasthenia gravis, B8, multiple sclerosis, DR2. Other ones are the Behçet's disease, B51, and congenital adrenal hyperplasia, B47, narcolepsy, DR2, good posture syndrome, DR2, abacavir hypersensitivity, B57. Next part is the paraneoplastic syndrome. Next part is the paraneoplastic syndromes and associated cancers. First one is the Cushing syndrome, which is associated with small cell lung cancer, non-small cell lung cancer, thymoma, pancreas, and the medullary thyroid cancer. SIADH, vasopressin, antidiuretic hormone, small cell lung cancer, non-small cell lung cancer, and the ovarian cancer. Hypercalcemia of malignancy, parathyroid hormone. Next part is the non-isolate cell hypoglycemia, insulin-like growth factor, associated with gastrointestinal cancer, hepatocellular cancer, renal cell cancer, and ovarian cancer. Acromegaly associated with small cell lung cancer, NSCLC, GIST, and the gestational trophoblastic disease, renal cell carcinoma, RCC, and the carcinoid. Hyperthyroidism associated with gestational trophoblastic disease, hypertension, renin associated with renal cell carcinoma, ovarian cancer, and the pancreatic cancer, calcitonin associated with small cell lung cancer, non-small cell lung cancer, breast cancer, gastrointestinal cancer, and the medullary thyroid cancer. नेक्स्ट वन इज द वेसोएक्टिव इंटेस्टाइनल पेप्टाइड वीआईपी जिसमें डायरिया होता है, डायरिया और इंटेस्टाइनल हाइपरमोर्टालिटी एसोसिएटेड विद पैंक्रियाटिक कैंसर एंड फियोक्रामोसाइटोमा. मेल फेमिनाइजेशन एचसीजी, स्मॉल सेल लंग कैंसर, नॉन स्मॉल सेल lung cancer, hepatic cellular carcinoma, and the yeast and the pancreatic and the testicular cancer. Next one is the subacute cerebellar degeneration associated with small cell lung cancer, non-small cell lung cancer, gastrointestinal cancer, lymphoma, and the ovarian cancer. Sensory motor peripheral neuropathy, small cell lung cancer, non-small cell lung cancer, Lambert-Eaton syndrome associated with small cell lung cancer, breast cancer, GIST, and the ovarian cancer. Small cell lung cancer तो almost सबके साथ associated है. Stiffman syndrome, breast cancer, thymoma. Dermatomyositis associated with small cell lung cancer, non-small cell lung cancer, breast cancer, and gastrointestinal occur. Dermatomyositis ये हमारा हो गया है. Sweet syndrome is important. It is associated with non-small cell lung cancer, breast cancer, gastrointestinal cancer, lymphoma, renal cell cancer, ovarian cancer, prostate cancer, and myeloproliferative Next one is the erythrocytosis, hepatocellular carcinoma, renal cell carcinoma, ovarian cancer, adrenocortical tumor, and the cerebellar hemangioblastoma. Pure red cell aphasia, non-small lung cancer, breast cancer, gastrointestinal cancer, lymphoma, and the thymoma. Eosinophilia associated with lymphoma, thrombocytosis associated with so big list. Small cell lung cancer, non-small cell lung cancer, breast cancer, multiple myeloma, gastrointestinal, hepatocellular, gastrotrophoblastic lymphoma, RCC, carcinoid, thymoma, ovarian, prostate, myeloproliferative adrenocortical, and the cerebellar and the pancreas. Coagulopathy associated with breast cancer, lymphoma, and the renal fever, which is associated with so many carcinomas. It includes small cell lung cancer, non-small cell lung cancer, breast cancer, multiple myeloma, GIST, hepatocellular, gestational trophoblastic lymphoma, renal cell carcinoma, carcinoid, and the ovarian cancer, prostate cancer, myeloproliferative disorder, adrenocortical tumor, cerebellar and hemangioblastoma, pancreas cancer, amyloidosis, breast cancer, lymphoma, and renal cell cancer. And this will be the second last part. I hope you like this video and found this video very helpful. Do share the video. Don't forget to subscribe. Thank you. Bye bye. And the last part, 10th part, will be uploaded soon.